Hello and welcome to today's podcast. I'm Emma Scott from CIPS. We are joined today by Pia Larsen, who worked in the NHS for around 10 years and has been Director of Procurement and Supply Chain at University College London Hospital for the last 7 years. Pia leads an award-winning team, and today she's going to explain how her and her team have managed to support the Trust through the COVID-19 crisis, working in conjunction with the national supply chain and sourcing some critical items to complement the extensive national effort. Pia, thank you for joining us today. So tell me what you've been up to then, Pia, you and your team, and how you've been responding to the crisis.
Well, it's fair to say it's been one of the most challenging periods I think we'll have enjoyed in our careers here in procurement in the NHS. And what we've been up to is we've been sourcing PPE for our clinical colleagues to wear in their clinical settings. And we've been also managing a very, very difficult range of supply chain challenges that have presented themselves during this extraordinary crisis. The team have been flat out working maybe 16, 18-hour days within the first sort of 6 weeks of the crisis. And they've done that with total dedication and commitment to what we're doing in order to work to protect our clinical colleagues working in the hospital.
And how are your team coping with this new way of working? I mean, there must be so many supply shortages. How are you managing to keep your hospitals equipped? And what have been some of the hardest things to source?
Well, I think the model that has been put in place once the crisis sort of presented itself was that the pandemic stockpile was deployed out into the NHS. And what that meant is we were receiving products not on a pull basis as we would do in ordinary times, but on a push basis as they came out of the pandemic stockpile. And what that meant is we had to stand up a new supply chain to receive those deliveries into our hospital. And we were receiving things in a very unorthodox fashion with little predictability and in a way that we don't typically receive goods. So we're receiving things in pallets when we would normally receive in cages. And these were very, very different and interesting things for us to deal with. I've got to say the team have found their footing extremely quickly because we have got some experience of responding to some extremely challenging events here at UCLH. Last year we opened a new hospital and had a very, very significant amount of work to do from a procurement perspective leading into the opening of that. So our ability to corral and motivate in a crisis is really, really very impressive indeed. And the team always step up to the challenge in these particular circumstances. And even though this was even beyond any of our imaginations, every single member of the team has really, really stepped up in the response. And they've done an extraordinary job of meeting that particular challenge. Things that we've been sourcing would be all the things you've been hearing about in the press, really. So we've been sourcing visors, we've been sourcing gowns, we've been sourcing respirators as they're known to the general public, we've been sourcing surgical face masks, and we've been sourcing a range of other things to do with oxygen consumables for ventilators, ventilators themselves, and some other medical equipment that has been used during this particular crisis.
And with things being in such high demand, have you had to look at new sources of supply, and how have you gone about this in such a saturated market at the moment?
Yeah, it's been extremely interesting, and we've learned all sorts of new things that we wouldn't have ordinarily done in our normal business as usual activities. So we've done a lot of sourcing out of China. In some instances we've been dealing, or most instances we've been dealing with UK suppliers, but they've been sourcing out of China, which has been completely fascinating from a supply chain perspective. We've learnt things about freight, which we don't typically deal with, and we've been sourcing from UK manufacturers who have not typically supplied to health, which has been really interesting. So some of my team previously worked for TfL, and they made contact with suppliers who they had dealt with in previous lives in order to really see if there was opportunities for new suppliers who were in a similar space but hadn't typically supplied to health to step in and step up really to the challenge that was presenting itself. And that has been really fantastically successful, with new suppliers entering into the health market, and providing very much needed product at this really extraordinary time. So that's been wonderfully positive.
And have you had to make adjustments to your contractual terms and payment options? I guess the landscape has completely changed in terms of how you would procure some of these items.
Yeah, and that's been really that's been quite challenging because, you know, ordinarily we would place a purchase order, you wait for the goods to arrive, and what we've had to do in some instances is pay upfront for goods. We've had to pay some partial payments upfront, and that's been really quite challenging because it's not how we normally do business. We would spend a lot of time pre-qualifying suppliers. We did sort of undertake some financial checks. We D&B'd suppliers as best as we could. We did ask for, you know, accounts and so on, even though things were moving at such a rapid pace. But it has meant that we've had to do things that we feel more, you know, that we wouldn't do in normal times, that we've taken a bit more risk. And really, thankfully, after a few sleepless nights, those risks, you know, they have not materialised, so that's been positive. We've managed to mitigate that risk, but it has meant that we are doing things in a different way during this particular crisis.
And do you think things will change going forward? Have you already started thinking about implementing some kind of plan in case something like this happens again in your supply chain, or some lessons learned from the war wounds that you've no doubt accumulated over the few weeks, and how you can implement them going forward?
Yeah, we definitely have, and we've started to think about our planning in a medium and long-term basis. The hospital is already starting to ask us to return to business as usual. So we're going to start seeing elective patients in theatres next week. And as part of that preparation, things are looking a little bit different in terms of how we would normally conduct our business. We have theatres will still continue to use PPE for patients coming through for theatre activity. And in terms of how we respond to that, I was just on a planning call just earlier today. There's a lot of national effort to try and think about what the plan looks like as we return to business as usual. But what we've done here at UCLH is started to make contact with our incumbent suppliers who we deal with in BAU, and to ask them about what their current position is. Are they experiencing any supply shortages or interruptions? Has their manufacturing been affected by conditions in China? Are they really having a problem with anything? And actually, we're receiving quite reassuring messages at this point that things are going well. And in terms of the sort of medium to long term position, we're really thinking about how we ensure that we are ready if there would unfortunately be a second wave of COVID, and that we would be planning to have some PPE in a reasonable amount available to us at a local level, that we wouldn't have to then commence sourcing some of those things off the bat. So I think it is important, and we certainly have tried to commandeer some storage across the organisation that allows us to do that. And the organisation has been extremely supportive of that as an approach, because they certainly feel that we need to be ready to receive increases in patients if that does transpire.
And I guess it's a totally different relationship with these suppliers now. I mean, it was probably very transactional and commodity based before, and the landscape's just made that change completely, really, I guess, forging deeper relationships.
I think one of the things that I'm always a true believer that relationships make for good business, and what we've found is that those relationships have been extremely valuable during this period. And in fact, I wrote a short piece about it for one of our trust-wide comms in recent times to say it's the relationships that will get us through this particular crisis.
Absolutely.
Our relationships with our colleagues, the relationships with suppliers who have honestly bent over backwards to assist us to do things out of the ordinary, to allow us to, we've had suppliers allow us to collect significant deliveries from their warehouses, so we could have product on site. They didn't have couriers available on a particular day, so one of my team went and drove to the supplier's warehouse to collect a whole load of oxygen consumables, which, you know, is a phenomenal, very extraordinary thing to do in terms of responding. And those relationships have allowed us to really draw on those expertise and to say, how can you help us in this extraordinary crisis? And the suppliers have been utterly brilliant, and not always able to meet our unreasonable demands, but they certainly have done so in good faith and in good humour to try and do as much as they possibly can. And people have been willing to volunteer. They've offered. I've lost count of the emails I've received from all sorts of suppliers offering their assistance to us here in the hospital, so which has been absolutely brilliant.
Excellent. And it sounds like your team have really pulled out all the stops and come together, and as your trust really has relied on them, and they've stepped up to the mark really. You haven't really suffered many shortages at all really, and you've kept things going. So how has that helped the profile of procurement within your organisation? I can imagine that it's put a spotlight on procurement, and you've certainly risen to the challenge.
Yeah, and we're very lucky here at UCLH in that we already had a well-invested team. We have a team who is working very closely within the organisation, and we've historically had very positive relationships with our clinical teams as well. But I've got to say the amount of love, affection and attention on the procurement and supply chain team has been quite overwhelming in a positive way, and that has really, I think, meant the team have pushed on at every single hurdle, because every time we had someone thank us or send us a text or tweet about us on Twitter, that was shared across the whole team, and I made sure that everyone felt they were part of that thanks. You know, it's one thing me receiving a card thanking me for all my efforts, but of course it's not me really, it's the team who are responsible for making it happen on a day-by-day basis. And the profile of procurement has been so important across the organisation, because there's been such a focus on PPE, and it's been so publicly visible. But, you know, what has been so incredible is that we've had intensive care consultants taking time to write to me or text me and thank us for what we're doing, which is allowing them to provide the care for patients in critical care. So it's been phenomenal. And, you know, we feature on the chief exec's briefing routinely, people asking, you know, are we going to have enough PPE and these sorts of things. And the support from the board has been really, really fantastic. And of course, we don't do it for the recognition, far from it, but it has been extremely, it's been extremely motivating and feeling as though we're really well supported across the organisation when it's been unbelievably difficult. And, you know, lots of sleepless nights. I've cried, the team have cried. You know, it's the responsibility, I think, cannot be underestimated. No. You know, it's been really quite something, and that sense of caring for your, you know, keeping your colleagues safe is so powerful that, you know, you can't help but work every hour that is sent to try to make sure that your colleagues are protected, and that's really what keeps us going.
Absolutely. That sense of doing your bit it must have an incredible feeling. It must be very tough on your team though. That sounds like they're putting a lot of hours in. I guess there's a mixture of remote work and you're in the office
Yeah,
today.
yeah.
I guess are they coping okay under the circumstances?
Yeah, they're absolutely brilliant, and we've instigated some things to make sure we keep in touch. We have a WhatsApp group that pings all day, with just nice sense of humour and these sorts of things. And I think it has been difficult for people who haven't been able to come in to the office at all for very valid reasons. But what has been maintained the whole time is our connection across the team. We do a regular Zoom call every morning, even if I don't really have much to say.
Yeah.
We're still keeping connected. I went and saw all of our supply chain teams last week on each of our sites, to thank them, very sincerely for what they've been doing. These are people on the ground who are moving PPE out into the hospital sites, of which we've got numerous. And they are exposing themselves potentially, and feeling as though they've also had to work an immense number of hours across weekends when we don't actually run that as a shift pattern. We've had people working 7 days a week when they're only employed to do 5 days a week.
Yeah.
And you know what? I've never once heard any of the team grumble, complain. I don't want to do that. I'm not doing that. It's been 100% commitment, and we've been overwhelmingly looked after by all sorts of donations. We have meals provided every day into the office. We've had care packages from the charity. We've had shoes delivered.
Oh, brilliant. Well, you deserve it. So well done to
um,
you and your team. It sounds like you've done an amazing job. So
Thank you.
well done. And we wish you continued success and stay safe, everyone. Thank you, Pia. Thanks for joining us
Thanks so
today.
much. Thank you.